Hello, I'm Dr. Dennis McKenna. I am here with Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, October 21st, giving you the update from Albany Med. Fred, if people knew what we talked about before the camera came on,
they would actually probably enjoy it.
They
Dennis.
might.
Just like we've been enjoying it.
We'll release it onto the YouTube. All right, first graph, New York State, people in the hospital with COVID. That number is 2,144. Visually, we can see that's flat.
Yes.
Next graph is the capital region. That number is a little bit different. It's 180. I think if we're looking at that, I would certainly prefer to see it flatter or perhaps even going down. It is a spike up, at least compared to a week or two ago.
It is, Dennis. And you know, some of the regions around us, we talked about this morning, the North Country and the Mohawk Valley, Amsterdam, Gloversville, they're also going up a bit.
Right. So let's take a look inside here in the medical center, what we're experiencing here. This is our morning census. We currently have 29. 11 of those are in the ICU. 4 of those are on ventilators. As it has been in previous weeks, Fred, if you end up in an ICU or on a ventilator, overwhelmingly unvaccinated.
That's right, Dennis.
In that number of 29, 2 of those are pediatrics, and as of this morning, neither one of those was in an ICU or were on a ventilator. So Fred, that number here at Albany Medical Center is about 1 or 2 less than it was last week. So while the region is growing, at least on this campus right now, we're not seeing a big change.
That's right, Dennis. And it's not clear to me why that's the case, but we'll keep tracking this.
Percent positive, 7-day rolling average in the region is what?
It is 3.8% today.
Okay.
So it went up a smidge. We had nadered at 3.6,
Right.
so we're up a little bit.
Let's pop open a new graph here. And Fred, you were talking about this. There's some new graphs that are out there publicly available. We're going to start showing new ones here.
That's right, Dennis.
I'm going for base. This new graph here may take a little while to get oriented to, so let's spend a moment looking at that. If you look on the horizontal axis, it goes back to April, and it looks at different time periods. If you go up on the vertical axis, what you see are bars, and those represent the different strains of the COVID virus.
That's right.
And they're different color codes. And then, Fred, there's one in particular that you can describe that's in gray. And which one is that, and what story does that graph tell us?
So, Dennis, the gray is the Delta variant.
Okay.
And if you look first all the way to the right, you can see it's dominant. It's almost 100% of today the variants that are being identified. If you scroll back, move your eye back along that graph, you'll see back in around May time frame is when it started, and it just kind of exploded. And what it did was it wiped out all the other variants. So I think this is an important point of information for a couple of reasons. So first of all, those other variants that we were worried about, remember we talked about
Iota,
Lambda, all those,
Mu,
they're gone.
They're gone.
And this is New York State data, but they're also gone across the country.
Right.
So that's good, and it's good also because we know that Delta variant is sensitive to the vaccine.
Right.
So if you're vaccinated, you're protected. And then the third thing on this graph, if you see that red line, I think it'll show up red, that's the total cases in New York State. And you can see we peaked and now we're starting to go down.
Okay.
So we have really one strain to worry about, Delta. The vaccine, is effective against Delta, and now we're starting to see a decline in cases.
Excellent. So there's a lot to unpack there on that graph, but it's an excellent graph. We can show that one again periodically, and we can look at other ones in the future.
That's right. The state redid the whole website on COVID data. There's lots more information, and we'll bring more of that to you in the coming weeks.
And if you're interested and you want to look yourself, you can Google this. It's New York Forward is the site, and then you can dive into the graphs from there.
That's right.
Fred, a couple other things to report about. I think people saw on the internet earlier this week about the passing of Dr. Marty Liebau.
Yes.
I think we'd like to take a moment just to kind of reflect on that. Marty was an incredible physician. She was part of our Albany Med community for decades. Her legacy is enormously important in this field of science and in pediatric infectious disease. Anything you want to say about Marty?
Yeah, I mean, Dennis, you know this. Marty worked on the polio vaccine.
Right.
And Marty was really so much in favor of vaccination.
Right.
So important. She really pushed that agenda for years and years.
She was very
really
passionate about
important.
it.
Very passionate.
Lead author, many articles, New England Journal of Medicine back in the early 60s on vaccination, working with the likes of Dr. Jonas Salk and others.
Yeah.
Remarkable legacy, obviously a tremendous teacher, tremendous clinician, I also knew her from her work up at Double H Ranch, where she was, at the time, the interim chair of pediatrics and sort of sealed the deal, as it were, that linked those Albany Med and Double H together. So Marty, what a wonderful story. And they posted about her on social media, and the number of comments were unbelievable. People from
really
all over the
huge.
country talking about the impact.
She's going to be missed, Dennis.
For sure. So on that front of vaccines, segueing from the work of Dr. Lee Powell, let's talk about this in the news, Fred. Two really important stories out there in the arena of vaccine. The first one has to do with the recommendation coming from the FDA to the CDC as to whether or not, if you've received one type of vaccine, let's call it Pfizer, whether or not you can also receive another type of vaccine, let's call it Moderna, either as your second shot or booster. And in the past, the recommendation was don't do that yet, but that may change.
That's right. So what the FDA is saying is that it's permissible to mix and match. So if you've had Pfizer in the past and Moderna's available, you can receive that. It's not a problem. And really, there are three vaccines, and mixing and matching, there are lots of different combinations.
So to be clear, if you received Johnson & Johnson, which we know is a one dose,
That's right.
if the recommendation by the CDC goes forward and you need a booster,
That's right.
you could also choose to go with one of the others as well.
And the FDA has recommended boosters both for Moderna now and J&J. So that's with the CDC, and probably in the next week or so, the CDC will act on that recommendation as well.
So people might be confused. They may say, well, hold on a second here. I remember listening to you guys a couple weeks ago, a couple months ago that said don't do that. And in point of fact, we did say that because there was no data to support it at the
No
time.
science.
Now they've studied it. They've looked at antibodies. They've looked at safety profiles. They looked at outcomes. And so the recommendation is you can do that.
You know, Dennis, it's an important generic point to make. We're going through this in rapid fire.
Real time.
We're learning real time how to deal with this virus and this pandemic.
Right.
So things that we know today, or things that we don't know today, we might know tomorrow.
Right. So to be specific, that recommendation will be looked at by the CDC. I believe the date is November 2nd and 3rd in that time frame. Around the same time, Fred, they're going to look at booster shots for children age 5 to 11 for Pfizer.
Initial shots for
Initial
children.
I apologize.
Right.
Initial shots for children age 5 to 11.
That's right.
Pfizer.
That's right. And so that data, we've talked about this before, Dennis, that data looks very good.
Right.
So that's going to go before the same panel. And the federal government obviously is gearing up to administer those shots, as you probably have seen in the press in the past couple of days.
From a timing standpoint, what we've heard the federal government say is if Pfizer is the one that's approved for the initial shot for children age 5 to 11, they would have that available to be rolled out as quickly as possible after November 3rd. And it would be first shot, wait 3 weeks, second shot, 2 more weeks till having full immunity. So theoretically, if you begin the vaccine process early November, you would be fully immunized in that child age 5 to 11 by the end of December.
So Dennis, there are over 25,000 pediatricians or their offices across the country that have been contacted and are preparing to do this. So the rollout's going to be fast.
All right, exciting news. We'll
much so.
report more when we hear. Changing gears off of COVID, let's talk about some news that we heard just this week. Albany Med, most wired, and that was something that we received. How many straight years is that, Fred?
8 years in a row now.
8 years in a
Dennis.
row.
Yeah, really a great run.
So this is a recognition by CHIME, the College Healthcare Information Management Executives.
That's
CHIME.
right. CHIME.
And what does that mean to be most wired, Fred?
Dennis, they submit a survey and they look at a whole host of different components of your IT system, and they grade you.
Right.
And they put you on a scale, and you get to the most wired category if you're a number 7.
Right, okay.
And we're a number 7.
Well, congratulations to Chris Couchet and the entire team here. Really tremendous work, and we're very proud of them for that.
Very much so. Great job.
If you haven't had a chance, on the newsstands this week is The Story, our newest version. We thank our communications department for putting it together. I always love The Story. I think it's a great profile into our workforce. This one in particular, some great stories inside, including a story about our great dean and some other really, I think, really good exposés into the lives of the people who work here.
Take a read.
Take a read. So The Story. So it's a fabulous one. Lastly, 2 members of our workforce that we want to recognize from, it's their week, as we say.
That's right.
It's Pharmacy Week, and
Pharmacy
it's
Week.
International
IP Week.
International Infection Prevention Week. So Fred, obviously they both are individuals who work in the hospital. Take a crack.
Absolutely. So the pharmacy is the pharmacy. Dennis, how would we possibly operate without them?
Right.
24 hours a day, 7 days a week, dedicated professionals, providing a service that really is fundamental to what we do. Led by Anthony DeSpirito, a great group.
A great group. One example that people may not know, when care is being delivered in the intensive care units, for example, or some of our other specialty units in the hospital, like the ED, the physicians will often consult with the pharmacists about which is the appropriate medication to use. They talk to what are called PharmDs. These are doctoral prepared pharmacists. They're really part of the inpatient care team, and that's just one example of the work they do.
You know, if you think about it, Dennis, when we were training, the list of medications might have been like this, and now that's 10 times.
I remember as an intern, Dr. Ed Tim.
Yes.
I talked to him all the time.
Yeah.
Come give me some help.
Yeah.
And then infection preventionists.
That's right. So the IPs, in terms of helping us manage infections in the hospital, or more importantly, preventing infection spread through the hospital. A critical group, you know, fantastic group, do a tremendous job, and a group that's been so incredibly important during the COVID pandemic. You know, just really outstanding.
Absolutely. And they are led by?
Rebecca O'Donnell.
Rebecca O'Donnell.
Rebecca O'Donnell.
If you look at the list of things that they work on as IPs, we think about them as COVID these days.
Yeah.
I mean, let's be honest, there's hundreds of different areas that they look at, including, let's take another example, surgical site infections. They partner with the surgeons to figure out ways to prevent infections that occur after surgery. Another fantastic team that we're so fortunate to have. Okay, that'll do it. We roll into the weekend. I think it's going to be nice.
It's supposed to be nice, cool, but nice. Nice October weekend, I think.
Did you get your apples yet?
Oh, of course.
Did you pick your apples? All right. For those that are working here this weekend, once again, around the clock, we thank you now more than ever. And for those who are off this weekend, we hope that you can relax, and we'll be back again next week. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.